Hi, I'm Jacob Lancaster. I'm here to talk to you about the welfare system today. Welfare comes under copious amounts of scrutiny without established grounds for it to be scrutinized. The Center for Medicaid and Medicare are dedicated to innovation and also their partnerships within the states. Medicaid has paid over 65 million people's bills for healthcare associated expenses. The largest share of those bills was for births. I work at a medical center where I work in an intensive care unit, so most of our patients can also be using insurance like Medicaid. These patients are in critical need of this care, and without this insurance, they wouldn't be able to afford such care. First, I'm going to go into the branches of welfare, followed by Medicaid itself, and then I'll eliminate finally some stereotypes surrounding the welfare system. First, there's 6 major welfare programs. They include temporary assistance for the needy families, Medicaid, supplemental nutrition assistance program, supplemental security income, earned income tax credit, and also housing assistance. These programs are funded by taxpayer money on a federal level. However, if the states themselves have too much expense, the states are only granted so much money each year. And so the states will have to pick up that budget after the fact. So states on the federal level work hand in hand to make sure that all these expenses are paid for. Subsidies for the poor are what these programs are really for. They're for people that have income that is below the federal poverty line, which is a set line every year by the federal government. So these people are in critical need of access like all the 6 programs I just listed. Lawmakers believe that they're taking advantage of these programs. In reality, in most cases, they're not. It's not an entitlement program such as Social Security or Medicare or workers' comp or unemployment insurance. Those are all entitlement programs. These are not. Medicaid is definitely the most controversial of all the programs. 1 in 5 Americans are actually using Medicaid, which is an extremely high number. In 2017, 75 million low-income families took advantage of the Medicaid program, and then half of 13.3 million of these recipients were for special needs individuals under the age of 18. So that's 47% of the 13.3 million diagnosed with a special needs disability. 47% were using Medicaid, which is an extremely high number. These people need insurance but can't afford it. Most of them actually have jobs, but through their work they don't receive the proper insurance, so they need some sort of help along the way. If they were to be working and, say, break their knee, a knee would set them under and they would be completely unable to afford it whatsoever. And most people wouldn't pay their bills because there's just no way that they could. They couldn't afford their medications or their bills. Now, Medicaid, in part, goes with them, and in the company that does their knee replacement or surgery, what they'll do is help them afford it by getting the best access they can and also making payments for it as best as they can to help the individual. Some stereotypes surrounding the welfare system is that they're lazy. They have more kids just to collect money for welfare checks. That people stay on welfare because they consider it free money, which it's not. But in reality, it's actually declined in the last 3 years. The amount of people using the welfare programs has declined since 2015. And about overall, greater than 50% of the individuals that are recipients of these programs are under the age of 18. So young people are really needing to take advantage of these programs, so it's important in their lives. Welfare has had a bad rap overall, and in reality, the Medicaid system in particular is a great investment in helping people get the critical care that they need that they won't. these patients would become sicker if they didn't have access to healthcare. By being able to go to the doctor, go to appointments, the eye doctor, you can hopefully discredit any future illnesses by making them more healthy. It is expensive, however, it does do America a great good.